It's the first of its kind in Canada, a federally funded office where First Nations people can report incidents of racism or discrimination while accessing the healthcare system in Saskatchewan. Today, Ottawa announced nearly $1.2 million to support the project, and the Federation of Sovereign Indigenous Nations will set it up. Vice Chief David Pratt joins me to tell us more. Vice Chief, I imagine a lot of work went into this. How are you feeling about this announcement today?
Oh, Sam, first of all, thank you. I just want to acknowledge another beautiful day in the beautiful unceded Treaty 6 territory here in Saskatoon. And I feel elated. It's a very, very important historic day for First Nations people in this region. And, we're just excited at the announcement today. And we're looking forward to working on the implementation and getting that office set up. It's years of work, hard work and dedication. And that day, the fruition is today's announcement, so we're very pleased.
Why do First Nations people need this kind of ombudsman?
Well, it's unfortunate, but there are tons of stories that we've received at the FSN, as well as our tribal councils, of experiences and acts of discrimination when our people enter the healthcare system, and that shouldn't be the case. When people are sick and they're not feeling well, to be further discriminated against when they enter the doors of an emergency room or an ambulance or a clinic or a pharmacy, it just further makes the process more difficult than it needs to be. So this is a great way of holding the healthcare system accountable to make sure to put the doctors and the nurses and everyone on notice that we're watching you and that there will be repercussions to the treatment of First Nations people within this region when we enter the healthcare system.
You touched on this a little bit. What message do you think this sends to healthcare workers?
There are a lot of good healthcare workers that do great work. And, unfortunately, there are some that harbor racist views and discriminate against not only Indigenous people, but other people too as well. Of course, Joyce Estraquan was a prime example of what took place in Quebec a year or so back when she went live on Facebook. And as she was dying, she went live on social media and recorded the comments, which were terrible, from those trusted with her care. So people that are entrusted with the health and welfare of our people need to be put on notice that there will be repercussions when they choose to discriminate or treat Indigenous people in a very poor manner, particularly when they're entrusted with the health and welfare of that person.
What are a few things that the Ombudsman Office will actually do?
Well, it'll be right now, we're sort of, the FSN is currently the health ombudsperson for our region. A lot of our complaints come directly to our table, particularly at the Health and Social Development Secretariat here at FSN. So now we'll have an independent health ombudsperson office headed and board and with a board and run by qualified healthcare professionals who have years of experience working within the healthcare system that'll be able to address those issues when they arise. And they'll have a central place to go. They'll have an office that they can attend, and they'll be able to address those concerns and those issues when they come up.
This is a First Nations-led project with federal funding. So what teeth will the Ombudsman actually have to affect change in the provincial system?
Well, I believe it'll be holding the healthcare system accountable. We already have a precedent here. When the Stonechild inquiry happened back in the day when those young men were being found frozen outside the city limits of Saskatoon, and the police, of course, were implicated in that behavior, a special investigations unit was established at FSIN. Of course, a number of things changed at the Saskatoon, tracking devices and GPS to track and locate the police officers. So it worked. We haven't had one person found frozen. Our young men stopped dying outside the city limits in the dead of winter. And now this office will hold the health care system accountable to make sure that there's no more deaths or no more discriminatory practice against First Nations people, and that they're addressed adequately, professionally, and speedily to improve the system and overall health outcomes for First Nations people.
Big picture, longer term, what are you hoping for from all of this?
Well, we're hoping that it improves health outcomes for our people, First Nations people. Of course, we're a lot lower in terms of some of the health outcomes. We want to improve health outcomes for First Nations people, and I believe it becomes with that treatment. A lot of our people are hesitant to even go to the hospitals or in to see the doctors because of the way they're going to be treated and looked at when they walk through the doors. So this is going to go a long way to make them feel more comfortable that there's a place, if there's any issues, that they can go to have their concerns and their voices heard, and those issues and concerns be addressed by the healthcare system.
Well, thank you so much for your time, Vice Chief Pratt.
Well, Sam, thank you for having me. Have a great day, stay safe, and it's a great day for First Nations people within our region. Thank you very much.
David Pratt is Vice Chief with the Federation of Sovereign Indigenous Nations.